How are you doing
Um,
right now? How are you feeling? You're back. You're
um,
the
it's a very mixed feelings. I'll be very honest with you. Like it's about a mix of happy and sad feelings. Happy in the sense that at least I managed to did what I can in my capacity, what I was able to. And sad for the reasons that there is so much that needs doing, and it is beyond my or even within the capacity of a single NGO or organization actually. So it's a very mixed kind of a feelings.
yeah. And can you share a little bit? I know you shared before I started recording, but can you share a little bit about what organization you went with and how long you were there for?
So I was there about for 13 days, and I was with a American organization called Fajr Scientific under the umbrella of WHO. So it was a kind of a joint effort, and we did it together.
And why did you decide to go?
So number of factors. So I've been involved in the humanitarian work in the past, but mostly I have always been involved remotely in terms of like telemedicine, fundraising, and other kind of in different parts of the world. But this was the first time I was seeing a particular pattern that there was a resistance and very strong resistance to not to help and not hearing out. And I just wanted to establish the facts myself. And what really intrigued was actually I have a few colleagues with me whose families are stuck in Gaza. One of the surgeon whose father was shot in the head, and he was unwell for like he was struggling for his life, and there was no neurosurgery available in the nearest hospital. He was literally in a camp. The wound got infected. He was not able to get any sort of a treatment, and his struggle, and he was pleading on the social media to people that can you come and help my father. He was pleading the NGOs, can you ask one of a medical mission that if a neurosurgeon can go inside and help my father. I had another A&E consultant colleague with me. Some of his family members died in the bombing, and some other were stuck, and he was trying to get them out, evacuate from Gaza. Another family. So I had at least five different colleagues who were working with me, who I knew them for years, and they were like normal people like all of us in day-to-day life. And when I heard the real stories from them and the struggles, and it really touched me, and it intrigued me that what's the reason why it's not being kind of help is not being sorted and they are being supported. So that really intrigued me to go and just establish the ground facts myself when the mainstream media and when the governments are not doing anything about it.
Yeah. Wow. And can you share a little bit about your experience once you got there?
So the few things which were kind of like few terrifying facts in the sense that you enter and it's completely just like a war zone. There is a constant drone, and you have a feeling like you are being constantly monitored and surveillance. Continuous fire shots coming from kind of from all sides. Then bombs. Although you agree as a part of a medical mission to stay in a deconfiscated zone, which is classified as a safe house.
Okay.
But even then, you hear kind of, and you get bombs very close to kind of, where your safe house is. And the hospital itself, which as per Geneva and Hague Convention, it is supposed to be the safe place. But you get sometimes bombs so close to it that the whole hospital literally shakes. There is no feeling of a safety. You feel very unsafe all the time. So that's kind of the one side of it. And then there were lots of medical and non-medical issues which I came across. And if you allow me, then I can go through them and explain what they were.
Yeah, please.
And so in terms of if I stay focused on the medical issues, so medical issues, I just want to particularly highlight this most important thing, that European hospital is the last kind of a remaining main hospital in Gaza, which is actually the lifeline of the Gazans right now. And
Mhm.
it is very important that we highlight this in media and try to save this hospital now. Because there you might have heard of a small another couple of few hospital like Al Aqsa Hospital, Najjar Hospital, and Emirati Hospital and Jordanian Hospital. But let me just go through each and every one. So Al Aqsa Hospital has already been attacked in the past, and it's already not working at a full capacity. So before the war started, actually, the Al-Aqsa hospital had the main operating complex. It was basically stopped working, and it was about to start a process of refabrication. So its workload was diverted to the other hospitals. So when the war started, they couldn't kind of, deal with that. So they converted just 2 to 3 labor rooms into the operation rooms. So these operation rooms are not dedicated proper theaters, which deal with the current sort of work, kind of, the trauma surgeries which are required. So this hospital is already in a very hot zone, but working at a very reduced capacity.
Mm.
And the ICU is limited. There's no PICU, and a lot of the departments have stopped working in that. Al Najar Hospital is literally like a small field hospital. It's not like a major hospital with just one operating theater, which cannot tackle major trauma surgery. Then Emirati Hospital has been focused purely for the women care. And the workload for the kind of delivery on daily basis is very high in that Gaza Strip. And it has only one operating theater and 3 labor rooms, which cannot basically deal with such a huge population with about 100 plus delivery of babies every day. So
Mm.
literally so many women at the same time are in a labor room with no proper sterile measures, privacy and other kind of, and things like that. Then comes the European hospital. So European hospital remains the last main hospital then in the sense, and the workload on it is phenomenal. And I explained in my previous some videos on the social media that it has 3 main streams of patients. So one is the main like acute patients, which come as a direct impact of the warfare, like firearm, bombing, burns, and all those sort of injuries. So which itself is a quite large number. Then second is the basically the patients who have been in the war operated in the last 6 months, because all those previous hospitals has been destroyed. There is no follow-up, there is no way or mechanism to help and support these patients. And
Mm.
these patients being just everywhere, and they have got no painkillers, no antibiotics, and there is a sky high risk of complications. So you have young patients with like orthopedic huge operation with external fixators attached to them and pus literally pouring out of them. So a huge patient workload with a lot of complications. Then the third group is the patients who are actually the day-to-day patients. For example, the diabetic patients, the renal patients, the cancer patients, and a lot of other. And they have nowhere to go. There are no GP surgeries, no field places where they can go and have their day-to-day. Like I give you an example, like I, being a vascular surgeon, deal with the diabetic foot sepsis. So something which like in normal day practice, a GP will see a patient with a small infection in the foot, treat it with antibiotics, can get treated with a small 1 week course of antibiotics and done and dusted. But
Mm.
those patients, because of lack of the review in time, lack of antibiotics, lack of any podiatry review, they are ending up with necrotizing fasciitis, which is a flesh-eating bacteria. And these patients are having above and below knee amputation just for this.
Oh.
And I did during my stay about 10 amputations just purely on the patients with diabetic foot, which could have been treated with 1 week course of antibiotics. So imagine the morbidity, young people ending up with this. So
Mm.
this is just, so the workload on a European hospital is just absolutely phenomenal. Like it has a bed capacity of 300. It has a patients more than nearly kind of, 2000. There are about 2 to 3 patients in each bay when it should be only one patient in there.
Mm.
And then there is no kind of the whole traffic system of the hospital is not like a normal way. So patients come and because their homes are destroyed, they have nowhere to go back. Their bed actually becomes their new home, and there is no rehabilitation, no physiotherapy, no painkillers. They're just lying there and nowhere to go. So hospital has come to a gridlock. And then these patients, young patients, because of lack of painkillers and antibiotics, they're getting sky high rates of wound infections. And there is another big problems in these patients is the bed sores, something which you won't kind of So young people, lack of food, they're already emaciated, poor immunity, lack of painkillers, no antibiotics, and on bed sores on top of that. So you pick one thing and you will see 10 more problems associated with it. So
Mm.
these are the different sort of medical issues. Then a lot of problems with the lack of medical supplies, not appropriate number of, you name it, any equipment, they lack it. Medications, a lot of other things. Then comes the non-medical kind of sites. For example, you might not be aware, these things have not been highlighted in the media. There is absolutely no electricity. So after sunset, there is absolutely pitch black and it becomes really very scary. There is
Mm.
no regular gas supply. People can't cook. There is no water supply. Apart from Rafah rest, there is no household. All the houses are being destroyed. So those people being moved into Rafah. So literally on every street, you will see a big, huge kind of, refugee camp. And those houses which are remaining in Rafah, they are not actually functioning properly because there is no light, there is no gas, there is no kind of, any other day-to-day facilities. Due to lack of the clean water, all the greenhouses I've seen plenty on the roads, kind of, they have all been destroyed because there is no kind of a water supply to them.
Yeah.
Then there is no clean water to drink, plus no clean water for their day-to-day necessities. So people are struggling to even shower and things like that. And people have to go into the toilets outside because they cannot flush in their home any kind of, the normal toilets. And I've seen people like standing in front of the toilets for a queue of up to like sometime like 200 plus people. So they have to wait sometime up to 2 hours to just simply go and pee. I'm sorry, excuse my, but I have to say, mention this so frankly, because this is just like a basic necessity of someone and how they struggle.
Mm.
And the women there kind of, with the kind of, they have no privacy, no hygiene. And they're struggling a lot due to the other, like I did an interview with a group of females from the medical students and junior doctors, and they really highlighted their struggles. And like the women are even struggling to get to the menstrual pads, and it's just appalling, like the basic need kind of, of day-to-day basis, and how can they kind of, work in that sort of environment.
Yeah.
So these are just a few examples which I'm giving kind of, so basically I saw people who were not able to get kind of, meal for a whole week, maybe kind of, one meal for 1 week. um Getting a clean glass of water is like a commodity, like sort of, those sort of things. So things which you see even in the social media, they actually do not express the exact scale of the problem, how deep it is. So I can keep on kind of, for hours, but kind of, please, if you have any more focused question, do ask me. I can highlight on that actually, if you like.
Yeah, I was gonna ask, I have, a few questions, but what was the thing that maybe surprised you the most about your trip? What was?
What surprised me the most was that these people kind of, there was actually like what I failed to understand, why no one is listening to them.
Mhm.
What's the reason, kind of, like I have not seen such a huge scale of suffering anywhere, kind of, in my career or in my like kind of a humanitarian kind of a crisis I've dealt with in the past, but I've never seen that somebody being ignored to that extent. And I'm not able to understand why all the international powers have completely decided to ignore and not listen and just chosen a side and ignore. These are the normal people like me and you, and their lives have turned upside down in just overnight. And when I mean like, when you hear a statement that kind of, that I have only two clothes left on me, kind of, what I'm wearing. So it was literally like that, literally, either their house is being bombed and they have to leave in literally in the two clothes which they were wearing. And then kind of, the banks are destroyed. They cannot access to any of their savings. A lot of have many relatives who have died, nowhere to go. And literally the tents they have made is from kind of, the rubbish they have collected from here and there. And sometimes, they have just made a kind of a self-made kind of a tent from those things. Um, and when they try to kind of, go and do the GoFund kind of, because of lack of electricity, internet, they don't have access. They cannot even publicize it. And then no one knows kind of, like you just go blindly and start asking people for money, and who will kind of, say, okay, whether I should or should not kind of, and the way they have been portrayed in the media. And you listen to each and every story and struggle, and you question yourself,
Mhm.
why they're being dealt like that, why they've been treated like this. And I could not find the answer, and it is still very frustrating to me.
Hmm. Yeah, I don't have the answer either. It's it's horrific and unjustifiable that we have sat by for 200 days and watched this happen,
Yeah,
and nobody, like, even, I mean, a UN security resolution for a ceasefire, and then nothing. They just
nothing.
continue with impunity.
I will be very honest with you, because the scale has gone beyond imagination and the level of catastrophe. It is going to the level that, it is not directly in the hands of the so many NGOs who are going kind of, under the umbrella of WHO to manage it anymore.
Yeah.
It has come to the point that all the international forces, world powers, make an international coalition, step in and intervene and try to make some efforts to reverse it. Otherwise, it is kind of, the level of catastrophe it will be. People like the ICC has used the word of plausible genocide. I think the word genocide will become obsolete for this. So it will be something beyond genocide. We have to come up with a new word to name it.
So you see no way forward, like, all of these little aid trucks kind of coming in, there was a ship with aid. You see no real way forward without international intervention that would force a ceasefire and then bring all of the aid in. There's no other way.
The scale of devastation there, it is beyond repair without such huge effort. Impossible.
Yeah. And you'll be doing some interviews. I know that you want to highlight what's happening and bring extra attention to this. What do you want regular citizens of the UK and the US and other countries that are materially or vocally supporting this ongoing genocide? What do you want them to do? What would you call?
I would like them to basically continue to highlight and raise awareness, continue to do the peaceful protests, and continue to speak to their MPs and continue to do the boycott, including and do as much as possible to raise this awareness and make the point. Because it is coming to the point that whatever is happening, the politicians or the power blocks are not listening. And what else do we need to do to get their attention? I think, like, for example, in UK, the elections are coming, and this is very important that we need to highlight and we need to think about it, that why the politicians don't listen to us, the common people. Like you have seen in UK, like there have been marches with more than 1 million people on roads, and it seems like nobody's paying attention to the public. So what we need to do and think about it, that is our political system actually doing what they should be doing? Are they listening to the public? Are they delivering to the public? So these are some very important questions which I would like people to think about in coming days and kind of think about it. That and the most important decision they have to make, I would request them, is to particularly about coming elections and think very carefully who they elect in the future elections to be their prime minister, someone who can stand and talk for people, not for you know what I mean, certain kind of forces.
Definitely. Is there any stories, like individual specific stories from your time in Gaza that you want people to know about?
I would like to share one individual story and then one story as a group of a certain group of individuals. So the first one is about an 8-year-old child who was in extreme agony, who was not even able to walk properly. And it happened because he was shot a bullet in his thigh. Because the most favorite shot, which we have seen every day, we were getting patients with bullets being shot in their legs. And for an 8-year-old, why was an 8-year-old shot in the leg? So I questioned myself. I couldn't and this child he was lucky that he survived at that time. And because there was so much problem in the north at that time, this child was not able to get into the hospital in time. So he barely survived in the refugee camps. So some people after having wounds and something, they were not able to get safe access to the healthcare facilities for weeks to months. So this child came to finally in Rafah after 3 months, and finally he got the safe passage and access. Somehow his wound healed and he survived. I was amazed. And this child came and he was not able to walk. He was in pain and agony. And this like a bullet, which was like a special expandable bullet, which bursts when it goes inside. And that was and this child was lucky that it didn't destroy the blood vessel in the body.
Wow.
And then I had to take that out, and with limited resources, with no CT scan. And of course, you can see the size of a 6-year-old with that big bullet in there. So I have to very carefully retrieve that and get that out. And thankfully, the child was okay, and he was much comfortable after that, and we did it. But I have to do it with minimal amount of anesthesia and with very extremely challenging. So I can send you his picture after that and stuff like that. But it was a very rewardful I felt very happy to help that child. But I still didn't have any answers why a 8-year-old was shot in the leg and what was the reason. And you will see these sort of stories every day, kind of, so this is just one example, but it really touched me. I thought I'll just share that. The second story I would like to share with all of you is about a group of individuals and who are the heroes of Gaza, and they are like a lost tribe right now. And I really, really want to raise a voice for them. And these are all the medical students. And the two main medical schools in Gaza, they have been destroyed, and they have no campus where they can go. And all their hospital sites, including the main hospital, the Turkish hospital, has been completely destroyed. So they have only left with the European hospital where they can go and do some placement and do some work experience. Because nearly 500 healthcare workers have been killed in Gaza so far, and which is against the Geneva and Hague Convention and and the international humanitarian laws. And they should have been all protected, but they have been killed against all these. So these medical students have been basically put in a place that they are working as residents, so which is well beyond their kind of what they should be doing. And they are doing an amazing job. I literally, when I was doing major surgeries there, and I came across, and I thought they are residents. They are working with me, assisting me, seeing patients with me, and helping and translating and so many other things. And I was surprised. Some of them were like second-year medical student, fourth-year medical student. And I was just very, very impressed by their skills, by their manners, by their approach, and by their professionalism. So, and they are like completely lost. They don't know what to do, and their almost whole year has almost been wasted, and they don't know where it will all go. I know the international community is trying to do something to kind of organize for an online training for them, but I want to highlight kind of that there are significant challenges with it, and there is no electricity, there is no internet. Only European hospital works, and there is a curfew after 5 o'clock, and you can't go out. So only the medical students who are on site at European hospital, only they can attend some of those online teaching session in the evening. Those who go in the refugees camps in the Rafah, they cannot even travel back, or they cannot have internet to access those. And these people are going to lose a significant amount of their years. And if they go out, and if they are not being accredited or recognized, they will lose like 2, 3, 4 years of the hard work they have done. And most importantly, if they don't get the right to enter back in Gaza, it will be a complete loss of the basically the future of the healthcare of Gaza, because these medical students are going to basically run the healthcare system in Gaza. So this has been destroyed in a very systematic way, and the way it has been kind of, these people are struggling. So I would really urge the international community, International World Health Organization, and the World Medical Organization to look into that and help these medical students, get them into the recognized institutions internationally, let them complete the training, like for example, a fourth year to start in the fourth year in any other international institute anywhere in the world. And when they complete, they can come back to Gaza to continue what they can and deliver the healthcare in Gaza. So this is very important, and I want to raise the voice on their behalf and give their message across. And I want all the world leaders to talk about them and to be aware of them, please.
Thank you so much. And thank you so much for your courage to go, to come back, to raise awareness for this, Dr. Sultan. I think it means a lot to me, and I know it means a lot to a lot of people. So thank you.